So anxiety, this is obviously just part of the human condition, but it's something that we need to address so that we can have the highest quality of life. And many people don't know this, but there's actually 3 different levels to anxiety discharge. When we're experiencing a low level of anxiety, what it does is it affects our striated muscles or our voluntary muscles. So that's like, the muscles that we can voluntarily flex. So people get tension in these muscles. They might get tension in the neck or tension in the back. A lot of back pain is caused by this type of anxiety. The body just kind of tenses up and it constricts. So that's the lowest level of anxiety. Another thing that happens when the striated muscles in the intercostals tense up, it causes us to sigh. We start sighing. And they're not sighs of relief, they're actually sighs of anxiety. So once anxiety passes that low level, it goes into what's called the smooth muscles. Smooth muscles are the inner organ muscles. So like the GI tract has a whole bunch of muscles. Your esophagus has muscles in it. Your stomach is a muscle. You have muscles all through the gastrointestinal tract. And when anxiety gets to that moderate level, then we start to see symptoms in this GI tract. We start to see things like, GERD, gastroesophageal reflux disease, where the acid is coming up. We start to see things like nausea, upset stomach, people vomit sometimes, or they get cyclical vomiting. It may go down into the bowels, and you can have problems with your intestines. People sometimes become constipated, or they might have urgency to use a restroom. They might have diarrhea. And it could be any type of urgency. So that would be more of a moderate level of anxiety. And then the highest level of anxiety is when it goes up into the head and the nervous system. That's where you see cognitive perceptual disruption. So this includes things like brain fog, lightheadedness, losing track of your thoughts. It might also include blurry vision or double vision or tunnel vision, any kind of visual disturbance. People even have hallucinations sometimes when this anxiety happens. You could have ringing in your ears or tinnitus. That could be a medical condition too, but sometimes it's just a sign of really high anxiety. And this is probably the highest level of anxiety. People can pass out. They can dissociate. They can have out of body experiences when their anxiety gets this high. So we want to know. It's really important to understand what these different levels of anxiety are, because we have to understand that in order to regulate anxiety. But before we talk about that, let's talk about why do we even get anxious in the first place. Freud referred to anxiety as a vessel of distraction. And what he meant by that is that as we experience life, different emotions are getting triggered. And some of these emotions are actually things we like happiness. Some of these emotions are disturbing to us. It could be something like rage, or it could be guilt, or it could be sadness, grief, or sometimes people even get disturbed by certain sexual excitements that they experience. When these emotions get triggered in the body, the mind sometimes freaks out, and it says, oh, that's not good. If this person becomes aware of that rage, they're going to do something bad. They're going to do something that gets them into trouble. So we got to send a massive dose of anxiety to try to block that. And so depending on how scared it is of that particular emotion will determine how big a dose of anxiety you get hit with. If it's something minor, maybe it's low-level striated muscle anxiety. If it's something more serious, it might be smooth muscle anxiety, or it might be that cognitive perceptual disruption that we talked about. So this is the function of anxiety. It's really meant to ward off these uncomfortable emotions, these uncomfortable conflicts, inner conflicts that we don't want to face. So how do we regulate anxiety? This involves several steps, but the first step is just even being aware of it. Just being mindful of the fact that you are anxious. People try to ignore their anxiety. They try to dismiss it or just brush it to the side. And that's really neglectful of yourself. That's like you've got a baby crying in the other room, and you think, oh, I'll just ignore it and it'll stop crying. No, actually, it's probably just going to cry more because it's becoming even more terrified that there's a monster in there, that it's been abandoned. So we need to attend to our anxiety the same way you would attend to a crying child that's scared. And that involves paying attention. Do an inventory of your body and figure out what are the symptoms, the physiological symptoms of anxiety that you're experiencing in this moment. Are you having striated muscle anxiety, or is it more severe? Is it smooth muscle, or is it even more severe than that? And once you have an idea of how the anxiety is impacting your body, the next step is try to connect the dots. Some people call this causality. Rewind the tape back a few moments and see what happened to trigger this anxiety. What was the event that happened? And once you identify that, then work up to what was the emotion that got triggered. And then work up to seeing how that emotion got covered up with anxiety in what ways. So, how did your body, what level of anxiety did your body use to cover that emotion? Once you connect those dots from event to emotion to anxiety, that has an anxiety reducing effect as well. So noticing the anxiety in the body will reduce anxiety. Connecting the dots makes it start to regulate, because now it's not just some random thing that took us, by surprise. There's actually a reason for it. It's a discrete reason that can be addressed. And so that starts to regulate anxiety. After you've done both of these steps, I usually encourage people to then do another inventory. Check back in and see, is the anxiety coming down? Is it starting to leave the head or leave the smooth muscles and go into the striated muscles? If it is, fantastic. Just resume whatever you were doing. If it's not, if that wasn't enough to regulate it, you may want to do another type of relaxation training exercise. So this could be something like 5 minutes of mindfulness-based stress reduction. It could be biofeedback relaxation. It could be some sort of self-hypnosis. But take 5 or 10 minutes to just focus on relaxing. And after you finish that, I usually recommend people set a timer so that they don't have to worry about the time. They can just focus 100% on that meditative relaxation exercise. After they finish that, reassess your body again. Reassess and see how high the anxiety is. Probably at that point, you're going to have come out of that really high anxiety and be back down into the lower levels, or maybe it'll be gone altogether. And that's where you can resume your daily activities. So that's a little brief tutorial on what anxiety is, what causes it, and how we can regulate it in a fairly efficient manner.